Emergency departments are inherently fast-paced. They're stressful for patients and they're stressful for the nurses who are caring for patients. My work really focuses on how we can leverage nurses and their work environments to optimize patient outcomes. One project that I'm very excited to be working on right now is characterizing hospitals by how they organize nursing care in their emergency departments. When I became a nurse in the emergency department setting, I saw the burnout that my colleagues were experiencing. And so I wrote for small grants in my healthcare system just as a nurse to see if we could get money to lead mindfulness-based stress reduction classes, to create apps for us to have a short meditation on the unit, to develop and implement virtual reality break rooms for nurses in our healthcare system. From there, I had mentors really encourage me to go back and get my PhD, and ultimately by then I was very motivated to show the value of nursing and why we need to invest in the nurse work environment. Nurses want to be doing this work, but they need to be supported in doing it so that patients can get the best care possible, which is ultimately their mission as professionals. They need us as nurse scientists to address these core issues so that we can advance better care and so that we can keep nurses in this profession. Penn Nursing is a hub for policy research. I actively work on science that informs legislation, that informs testimonies for policies that are being introduced at the state level, and that really gives me a lot of joy with my work. It impacts whether a patient's gonna wait for 2 hours, 4 hours, 12 hours, or days in an emergency department to get life-saving care. It impacts whether the nurse who sees them is going to be able to connect with them multiple times per shift or only a few moments at a time. The funding that I've received from my research really has a direct translation to the individual patient's experience.